Well, you know, we're going to go through the data today. The data continues to be grim, but I think Clark Kellogg hit the right tone. Look, the end of this is in sight. We can see the end. Unlike the spring, unlike the summer, we couldn't see the end. We can see the end now, and we just got to get there. And we got to build that bridge between what we have today and build that bridge until we get to that vaccine. And speaking of the vaccine, you know, we continue every day to get better and better news. You know, Pfizer and BioNTech have announced that the final analysis of their drug trial shows that their vaccine is 95% effective, which is higher than they originally had announced. Latest report means their vaccine is even more effective than they at first thought. Moderna has announced its vaccine trial shows it to be 94.5%. And so both of them, you know, very high. The experts told me early on, you know, not to expect anything this high. So I think it certainly exceeds any kind of expectations that we had. So we look forward to starting to get that. We hope one of them in December at some point, and the other one we hope into January. So we're very, very excited about that. So let's go to, Eric, let's go to our data slides, and we'll start. And I want to talk about this number because we need an asterisk with this number. And let me explain. This is the reported number of cases. And let me explain why we need the asterisk. We have seen the number of antigen tests go up appreciably. It wasn't too long ago, it was literally a handful of these tests. Now we're getting large numbers of these tests that are rolling in. We made a decision to double check these basically. And that means going back, making a phone call, going back to the health department, finding out the facts that surround that particular test. And so we started to do that. And so nothing is actually confirmed until we get that positive from the antigen, but then they go back and they do some additional fact checking. Most states, I'm told, most states are not doing that they're just throwing those directly in. And I understand why, because this is a very time-consuming process. Well, on Monday, we got to the point where we were not clearing every one of these tests every day. In other words, that was the first day, Monday, that we were not clearing these tests. And so the only thing that was dropping in, the only thing that continues to drop in is when that test has been checked. So as of today, I'm told by our data team, there are 12,000 of these that have not been double checked, which means there's 12,000 that we've received. We have not been able to double check them, so they have not been able to move into this category right here. So big asterisk here, big asterisk from yesterday as well. I don't know what that means, but you can kind of do the math. If they started backing up on Monday and we now are 12,000 back, you can figure out that for the first few days of this week, you know, we've got to spread those 12,000 out among what we're showing here. Now, I'm told by our team that usually, I don't have a percentage, but usually they pan out. In other words, once they go do the factual check, yes, they're confirmed. So most of that 12,000, we would expect most of that 12,000 to show up over here. So what it shows is that the number we're reporting, which is already a very, very high number, 7,787, is appreciably higher than that. So I hope to have more information tomorrow, very specific, granular information, so we can tell you, better tell you, you know, roughly what that number would be. But we don't, so far, our decision is not to do what some states have done, which is just to throw them in and count them once they came back positive, but to actually do some investigation before we check that box. I want to put that asterisk on there. We have 343 new hospitalizations reported in the last 24 hours. So this is a large number. 8 of the 10 highest new hospitalization days have come in the last 10 days, including today. We're closely monitoring the hospitalization data to ensure the virus does not overwhelm our hospital system. And we're going to hear from people today who are going to report directly to you about what they're seeing in their hospital. And we'll have that in a little bit. Sadly, we also have 63 deaths reported since yesterday and 38 new ICU admissions. Eric, let's go to our top 88 or 88 counties and look at these counties. Again, all 88 counties, and as the state continues to turn red, and we'll get to that in a minute, I would suggest that anyone who wants to really understand exactly what's going on in their county, they must look at these numbers, because these numbers tell you how high the rate has been of new cases in the last 2 weeks. And so, you know, we go from a very, very high, and we'll get to that in a minute, down. Our last county is Vinton County. But even in Vinton County, our 88th highest county, the lowest county in spread in the last 2 weeks, even Vinton County is almost 2 times the amount of cases in the last 2 weeks that the CDC says is a high incidence. So they're almost double what the high incident level is. Eric, let's look at the next slide, please. So if Vinton County at the lowest is almost twice high incidence, if you look at Mercer, they're 12.5 times the high incident level. Putnam, 12 roughly, Lake roughly 10, Allen roughly 10, Van Wert roughly 10 times, and on down. So every county is very high incidence, and some are just sadly off the charts. We do have, as you've seen there, 4 counties with 1,000 cases per 100,000. So just doing the math, what that means is that in the last 2 weeks, 1 out of every 100 persons in that county has tested positive. In the last 2 weeks, 1 out of every 100 persons has tested positive. And so as we look at what we're doing, looking at how careful we have to be, that gives us a pretty good indication that we have very, very great spread. And of course, that's just the people who have been confirmed and just the people who have actually tested. We also know that there are people who don't show that they have the virus sometimes. And so they can be spreaders as well. Now let's compare, let's go to the next slide, Eric. Percent increase in cases versus testing. Again, we continue to kind of run into this issue where some folks look at this and say, look, you're testing more, so that's why there are more cases. This is how much the increase in cases has been. This is how much the increase in testing. So we've gone up since October 17th. We've gone up 43% in testing, which is good. But we've seen increase in cases at 299%. So you can see it's a phenomenal difference. Let's go to our another early indicator, which is emergency room visits with COVID-19. This chart shows the COVID-19 diagnosis of patients that presented to Ohio emergency room departments. It's depicted in a 7-day centered moving average to provide a clear picture of the general trend. You can see that the number of people presenting to the emergency room has shot up since late September and continues to grow. And as you can see, it is just going up like a rocket. Of course, this is the earlier indicator before potentially people are in the hospital. Let's go to our hospital slide. In addition to tracking the number of emergency department visits related to COVID-19, we also monitor the number of patients who are treated in hospitals. This is key to understanding the increasing burden this virus is placing on our hospital system. And as I said, we'll talk more and hear more from people who are at the front line in just a few minutes. At our peak in April, we had a little over 1,000 patients in the hospital before we dropped in late May and into June, as you can see. We are now in the middle of another surge in patients who are hospitalized, one that continues to rise. As of today, we are at 3,829 patients who are in hospitals today, COVID patients who are in hospitals. 3,829, 943 of those are in ICU. These are the highest patient counts we've had during this pandemic and more than double what we've seen in previous peaks. And so we watch it go up, and this is ICU, this is hospital count, not admissions, but actually the number of people who are in our hospitals. Travel advisory map, we'll do this very quickly. You'll see cases across the country are clearly rising. Positivity rate, as you can see, is going up. You can see roughly where ours is. We have flagged in the past, and will continue to do so, states that are above 15%. Sadly, we are quickly headed to that number. So we are almost where we have been, the number at which we've been advising people to be very careful if they travel to. And that's the reality that we face today. Let's go to our alert system. And again, this alert system really needs to be read in conjunction with the number of cases slide that we showed a moment ago. We're more than 4 months into our advisory system. We're hitting 2 critical milestones this week. For the first time, we have a county that will be purple. This means that they have flagged 6 or more indicators for at least 2 weeks. This is a sign that we're starting to see sustained impacts on our healthcare services, impacts on our hospitals. In addition, this is also the first week where we do not have any yellow counties at all. So Franklin County is moving today to purple. This is their second week of flagging 6 indicators, including sustained increases in emergency visits, outpatient visits, and hospital admissions. While Franklin is the only county moving to purple this week, we see similar stories in other parts of the state. Our healthcare system is feeling the impact of this disease, and hospitals are worried about being able to keep up with staffing of nurses and doctors and other support staff. As I traveled around the state yesterday in 6 different cities, communities, I had a local doctor with me at every stop, and that was the number one concern, is personnel. This is spread everywhere in all 88 counties. We can't borrow from one county to the other, and we can't borrow from other states. We see the great surge all across our country. Other counties may not be seeing continuous uninterrupted increases in the same way that's causing Franklin County to go to purple. But we should make no mistake about it. Almost all counties are seeing more cases and more healthcare use that could threaten the medical system if this continues. We also have 3 other counties that are meeting as many indicators now as Franklin. Since this is their first week meeting these indicators, we have moved them to a watch list. If they continue to accelerate with the use of and the pressure on hospitals and the healthcare system, then next week they could and would turn purple. They're Lake, Lorain, and Montgomery counties. Lake, Lorain, and Montgomery counties. We have 5 new red counties this week: Columbiana County, Darke, Fulton, Perry, and Van Wert. None of these have been red before. In fact, some were yellow as recently as September or October. These parts of the state, these counties have never been red before and were largely spared during the spring and summer waves of the pandemic. Now it is simply everywhere.